So, welcome back to the Epic Master Clinician program when we're doing Couples Counseling Part 2 today. And so a little bit about today's agenda. So I'm going to do a little bit of the housekeeping. We're going to go through the disclaimer again. I'm going to do a little quick review of Part 1. We're going to talk about love, intimacy, and sex, a little bit about on relationship navigation. I'm going to talk a little bit about relationship structures so that you understand some of those couple relationship stuff as they relate to family dynamics. We're going to spend a bit of time on repairs and apologies, and we're going to do some case conceptualization stuff with different kind of cases that I've seen over the years that are notable for me. Again, a little bit about me. I'm a registered psychologist. I'm also a certified sex therapist and a diplomat of sex therapy, which is an honorary designation that ASECT has. So in terms of the couple relationship stuff and the sexuality stuff, there's lots of training and experience that I have to help you guys get to know this area really well. So again, welcome back. Reminder, remember to complete your feedback forms for each session you attend. And right now the archive website is currently being updated with all of the previous and some of the future ones set up. So we're going through and updating a lot of the PowerPoints as we go through the years, and we're adding new concepts and new topics regularly. So be aware that those are new, some new ones are coming in the future, and happy driving here for going forward. So again, reminder, participating in or viewing this session of the Master Clinician series does not qualify you to offer couples counseling. And there's no technical qualifications that you require. So this is about, you need to know what training you have done for you to be comfortable working in the area. I think I've seen a lot of different dynamics and people talking about it as, at what point are you, open quotes, qualified to do work in different areas? And I think so, if you want to say that you're a qualified couples counselor, I don't think there's such a term. But most people have had training in couples counseling and courses. And so this allows you to work with couples in terms of the areas. And so you just have to know your scope, you have to know your experience and how that information applies. So even if you're doing Gottman's is one type of couples counseling. And so you need to know a lot of other information. I guess the key point is, if someone comes in without a master's program or a counseling history, and you take, you watch my video, and you don't have that master's level training, then that's where we're going to get more into that issue. So again, today we're going to be talking about intimate topics and asking each of you to apply some of these concepts to your own relationships. So in light of this, please keep this in mind, that we are all responsible for making this session safe space. It's imperative that everyone is able to deal and feel comfortable sharing their thoughts. We will strive to create an environment where everyone feels included, respected, and able to address the, we will strive, we have some fun here. It looks like there's an ambulance kind of making some noise. So we'll strive to create an environment where everyone feels included, respected, and able to express themselves openly. This includes asking questions. Now, be aware that generalizations will occur. And the reason I do this is these patterns are commonly, but not always, seen. And all of the information presented is backed with a lot of research or it's not just my opinion. So when we use the terms that are generalized based on gender, i.e. in masculine and feminine, men and women, these are the terms commonly used in research. And so, as we go through some of the questions later on in this, then if you have any particular questions regarding that, we can chat and talk more. Again, some things will not apply to you, and that is okay. We just want to create that safe space for everyone. So, things to consider. So now, when we're talking about working with couples, to me, working with couples is a next level up process compared to working with individuals. Because working with individuals, you just have to deal with one individual and what they're experiencing, and you don't have anything relating to them except yourself. When you have a couple in a session, you now have to look at how that couple interacts with each other and how you're interacting with that couple. So there's a three-way dynamic commonly occurring. And so within that system, I want you to be aware of that you have to be alert to trust issues that might be occurring and whether they're willing to disclose information during that session. You want to be aware of the actual or perceived power differential. So sometimes individuals will say there's a power differential, and which means, oh, someone's in control and they're always doing that. And that could be true, but it could also be the exact opposite. And so some individuals, when we're looking with couples, will say that I'm being controlled, but really they're the ones that are controlling because they feel controlled. And so you just really have to be aware of what's going on as you're that third party. When doing couple therapy, it's really also important to know that you are the leader in that system. And so some individuals will come in and doing couple counseling, and they'll sit back and let the clients run the session, and they could argue for the whole hour, and you're not actively doing that work. When you're doing couple therapy, you need to be in charge. You need to lead that system, and that's going to require a higher level of assertiveness in you to be able to manage and navigate and make sure that they are following what you know needs to happen in that session. And there are some individuals, when we're looking at high conflict cases, who are happy to try to take control of that session because they're going to be the ones that want to have the attention paid to them, and that they're saying they're paying for this service, so they want to get what they want. But when we're dealing with a couple, we have 3 individuals that we have to navigate that dynamic. So also much more ability to take an objective stance as you're dealing with individuals who are possibly having a different objective, a different perception, a different kind of experience going on. You need to be able to sit on objective and listen to the information that they are talking about, be able to be aware of whether it sounds emotionally laden, and if they're being objective, which sometimes is what's required to call them on their stance and their issues. And lots of times we're looking at balancing of sides and perspectives. So if you see high levels of control or an imbalance in power, part of your job is to rebalance that so that you can get movement and negotiation. That sometimes requires you to even move. I will move my chair, sometimes one side to the left, to align and side with someone who needs more support to be able to kind of bring things forward in that couple session. And then learning really good navigation skills. So this is about helping clients and the couples negotiate and navigate what they want within that relationship. And a little put a note that I put in on the bottom is watch out for alligator tears or the wounded duck pattern. And so alligator tears are fake tears where someone is crying because it works for them. It gets them what they want. Everyone pays attention to them and stops challenging or calling them on their issues. The wounded duck pattern comes from actually nature. So what happens is the wounded duck is, and the healthy version of a wounded duck is when we're looking at ducks when they're flying, they will fly in a V. And so what happens is if one of those ducks gets injured or hurts or has to land because of injury or illness, there's some history where one duck will join that other duck to either wait for them to heal, get better, to rejoin the pack, or however we call the duck, whatever a duck group is, or wait for them to die. But it's kind of, they still kind of have that team. And so what happens is some people will play the wounded duck in order to have someone side with them because it works as well. So it might not be the alligator tears, but it could be like, you've hurt me and therefore you need to make sure you're paying attention to me and fixing that. And we're not going to talk about anything else until I feel that I am healed and we can go on. And sometimes it's valid. Sometimes it's used as a strategy to not have to be accountable for their own issues. So be aware of those components. More things to consider. So working with couples requires that therapist to, again, manage expectations or standards in areas commonly related to gender and sex. Some individuals will bring in either their gender, their sex, being male or female, or even sex as in sexual intercourse and those sexual dynamics. And so I would say be prepared to hear a lot of sometimes cultural expectations or even traditional expectations on what the roles might be. And so there's a challenge, and we'll talk a little bit more about that later regarding cultural components, because you have to be able to be aware of those, and sometimes your job is to not dictate what needs to be done, Your job is to be able to help navigate what is a healthy psychological principle and how that may or may not integrate with cultural or their own perceptions of what they want to, how they want to run it, the relationship. So also know what you want them to do. A lot of couple sessions when people originally start, they don't know what they want. So when I'm working with clients, and I think I'm very structured on that beginning point because I want to know what the goals are. I want to know what we're going to be working on. I want to be able to break that down into kind of tangible skill sets that we can actively work on, resolve, move through, navigate, or even answer. In order for you to know what you want them to do, not only do you have to have a good foundation in terms of what is healthy and some of the agenda components that they are bringing forward, but you need to know how to navigate helping them figure out what they might want, because they know that things aren't good and they're not happy, but they might not know what it looks like to be where they want to be, or they can't visualize it. And so that's that interplay back and forth about helping them set some concrete, tangible tasks that will help them get what they want to help fix the issues. So that's you moving back and forth to try to, understand their language patterns with kind of you as a psychologist and therapist job to kind of move things forward. Remember, anyone, there's that no ask process. So you might know, you might not know, you need to ask and have them be able to ask each other to get that information. And that any one change. So think everything is systemic too, especially when we're dealing with couple stuff. Even if one couple may also come in individually sometimes, if they can make a change in a system, that will impact the whole system. So be aware, just because you don't see anything happening in the short term, as that inertia starts to pick up and we're getting a little bit of change in something, everything that's attached to that will have to adapt in order to be able to allow for that change, in which whatever one is more powerful tends to win. And so hopefully that is the more healthy one. And finally, home practice is essential. It's like going to the gym. If you're going to go to the gym on the amount of times, that's maybe once every week, once every 2 weeks, or even once a month sometimes, and expecting to kind of get into really good shape from a relationship perspective, that's like going to the gym once a week, once a month, and so it's not going to get those results because they're not going to stick as well until you can do this kind of regularly. And it takes about, on average, in my experience, and even talking to kind of some other concepts and professionals, about 2 to 3 months of regular practice, 7 to 30 times, to be able to get that inertial system, that habit in, and get that momentum moving. So just be aware of that. Sometimes we can get really fast change, but normally stable change requires consistency. Okay. So most couples issues are kind of related to these 5 key areas. And so as we go forward, one of them is communication and micro skills. And so when we're looking at communication and micro skills, I'll go into a little bit of that to help find out, build that. We talked about that on round 1 a lot. Intimacy, sexuality, and sensuality is another common one that I see regularly. Breach, betrayal, and trust issues. The number 4 one would be relational navigation stuff, which would be understanding how couples will navigate, communicate, negotiate in what they want within their relationship, so that if they can't negotiate issues, then they get stalemated and then you get this conflict. And then the last key area is parenting. And so I'm going to throw a few other goodies in here for you at the end, but these are the most common, the ones that I've seen. So when you're looking at this and getting additional training, these are areas that I would encourage you strongly to be well trained in, because you might only need one of these to really spend a lot of sessions working with someone, because even like betrayal and trust issues, I can spend a lot of sessions if there's been a bunch of breach in the relationship. So I may never get to some of these other ones. The communication and micro skills is usually incorporated into all of these as well. So kind of review from the past from part 1. So we talked last time a little bit about the most common couple issues. We talked about the top 6 methods for couples counseling, the difference between empathizing and systemizing and theory. Talked a little bit about attachment theory, gender sex differences, and language patterns and styles. So I encourage you, if you haven't watched one yet, that one is the foundation to this part 2. We did a bit of summary of Gottman's research. Normal marital sadism was one of those concepts. And then we talked about difficulties regulating couples' emotions. We did the setting up of that first session, talked a little bit about session goals, and then some communication basics. So that's a little bit of the review. So as I go forward, this foundation stuff of part 1 is what you need to be able to now apply the stuff in part 2, which is where we get to now start part 2. Off we go. So this is all the new stuff for you guys. So remember last time I talked about alexithymia. And so here's my 2 favorite handouts. One of I've created, one I did not. But the key component is when we're dealing with feelings and expression of feelings. And I said particularly when I'm dealing with men, or you're going to see this with a lot of autism spectrum disorder, the ASD dynamics too. So this is where we're going to get some of those difficulties in putting feelings into words. When I use this handout with my clients, I call it level 1, level 2. And so a lot of times I'm using the feeling faces one to help people work with identifying the feelings, because the words may not jive with anything they can communicate. So when they look at the picture, and you can see a bunch of these pictures, and I'm going to be a little bit picky because I'm going to teach you something that I want you to be aware of when we're talking about feelings. So for instance, and a good example is, let's take a peek at the how are you feeling today with the faces. And so one of these is like anger. And so sometimes anger is a valid feeling, but sometimes anger, we'll say, is a surface feeling. So I want to know if there's any other feelings that are occurring underneath that, because then we're getting at some of the root. Stressed, I think, is another one. I don't know if I'd use hysterical as a feeling, but they're playful dynamic. And so I want you to be able to, people use stressed as a feeling, and I'm not going to use it because stress can be a physiological response. And it can be a little bit of that feeling as well. And so just be really picky with the feelings. The ones that I don't want you to use is, positive and negative, good and bad. Those are not feelings. But they're commonly used, or I don't know. So stressed, good, bad, I don't know. So once they're using that, it allows me to be able to identify what their feelings are and then what's attached to those feelings, which is usually there's a bunch of belief systems or thoughts connected to that. And so that's the stuff that I want to pull out. Once they get better at being able to identify the feelings, then I allow them or they can move to step 2. So I usually have a 2-sided sheet for this one. And so if they flip it over, they can have now the list of feelings that people have, but often fail to identify. And so this expands a little bit more into some of those details. And in some other places, you've seen the feeling circles where they have kind of tiers going in. So that's another one that's pretty nice. But this is the ones that I commonly use. And so this, again, is a nice skill set for you to be able to use in your office to be able to help identify what people are feeling if they're having difficulty doing that, if someone's asking them about that. So since we're talking about feelings, I'm going to start off with love. And so Sternberg is one of the common theories that I want to be able to incorporate into this. And so Sternberg's triangular theory of love talks about 3 key areas. And so the 3 foundations are intimacy, passion, and commitment. And so with that, we have intimacy is defined as those feelings that promote closeness, bonding, and connectedness. And so that is the non-sexual component. When we have passion is that sexual component. It's that it can be lust, it can be the physical attraction, sexual consummation, the romance kind of feeling, stuff like that. And then the last third component of the triangular theory is commitment. Now, commitment can be defined as either short-term or long-term commitment. The fact that there is a commitment to the agreement versus none is the key point of this one. And they have a wonderful triangle dynamic here that kind of explains it. The next slide also kind of breaks it down into another visual so we can explore that. So if we have just intimacy, we call that liking love. If we have just passion, we call that infatuation. If we have just commitment, no intimacy, no passion, we have empty love. Then when we start combining these together, we have intimacy and passion. We have what's called romantic love. In there, there's no commitment, but it's that romantic system. When we have intimacy and commitment, we have companionate love. And so that could be your friendship love. There is none of that passion occurring within your system. And then when we have commitment and passion, we have fatuous love. Now, fatuous love sometimes historically would be called movie star love, I believe, or that's what I've called it. I remember reading something about a dynamic where a lot of the movie stars, when they get into a movie and they have this high level of connection, this passion, and they kind of get married really quickly because their characters sometimes will have that bond. And so they get married and it lasts a very short period of time. It's usually lasting that 1 to 2 year. And so it doesn't really have that level of intimacy because that level of connection and depth and that closeness never really got to develop well. And so it tends to be quite short term. Most people tend to want to ultimately go into that consummate love. So the intimacy, passion, and commitment all together leads to consummate love, which is kind of the top tier of what people are doing. Now, we also have some of the stuff, and this is a little quick summary of the 7 styles of love. I was hoping to add in the Greek types of love as well. And so that would look like, we'll look at that maybe for you in a little bit after we take our break. But we had stuff like there's storge, eros, and those ones that look like family love, paternal love, maternal love, friendship love, kind of the sexual love. So the Greeks have a whole categories of love that they have kind of talked about to be able to help explain the different kinds of love when people are talking about love. Because sometimes when people are talking about love in relationships, they may be talking about the in-love feeling versus a love for someone or something, and what kind of love is that? And so again, something that sounds nice and easy like love actually has a whole bunch of labels and types that really, to be able to explain it really well for individuals so that they can help identify where they're at and what might be happening. Now, lots of times when I mentioned about the in-love feeling, we call that limerence. So limerence is that state of being infatuated or obsessed with someone, and that's another person typically experiencing involuntary. It's characterized by a strong desire for reciprocation of one's feelings, but not primary for a sexual relationship. So the picture, I think, of the girl here with the hearty eyes and everything is a beautiful example of what limerence looks like. It looks like infatuation. It looks like that in love. There's lots of dopamine and oxytocin surging. It lasts longer than romantic love because sometimes there is that relationship commitment going on. And it's common. It is a norm for lots of beginning relationships. But it doesn't last as long as typically your healthy committed relationships. And it doesn't last as high because it tends to fade within usually, anywhere from 2 to 3 months to 2 to 3 years is a duration that limerence tends to kind of last. And that bioevolutionary makes sense in order to be able to help relationships bond, connect, and usually that's when your childbearing history would start because they've had that connective. And so there have been cases of just a few weeks, like I said, to even several decades that individuals have had that limerence feeling. But again, our biology is all different between us and those connections. So it's a whole fascinating study of what's going on with people when we look at that. So Dorothy Tenoff is the one that studied that. And so if you're looking for more information about limerence, that's where I would encourage you to look. But I just wanted to mention it because to me, this is one of those core foundations of information that I want you to be able to know about because it doesn't last too. And so I've had some individuals move into what we call it serial monogamy. Well, I'm not in love with them anymore. I'm not having that limerence. So therefore I've fallen out of love. So I'm going to divorce them and separate. I'm going to move to the next person. And then they jump in that same dynamic again. They just keep jumping relationships because they've never developed that strong, romantic, healthy commitment partnership. They're just looking for that dopamine hit with the oxytocin surge. And so in some ways, I would say as Molly, so some of the drug, ecstasy, kind of facilitates some of these similar feelings in people, and that's why they tend to like it a lot. And so now, once we get a little bit of love in there, and we're looking at now we've started a relationship, and we're working with that, another key concept I want you to know is what's called differentiation. Now, this is my drawing that I've created based on the interpretation. I've not seen this anywhere, but there's no really good visual diagram that I could make and find of differentiation. So this is how I have drawn it. And so here's how I'm going to explain it. So when we look at the two circles, these are the two individuals. You could have more. But in order for that, the two circles, so I'll take this as your couple, you need to be strong enough to push on each other, which is pushing. You can see the two inner arrows in there. That's pushing on each other to grow. You also need to be strong enough to take a step back from the relationship, short-term or long-term, depending on the circumstance. But the outer circle is doing that. You're doing it within the team for the team. And so when you're looking at that and working with couples, you need to be able to know is what do you want and how do you want to balance that within the team, and while the other person is doing exactly the same thing. And so this is where that relational navigation component comes in, so that we know we're knowing what we want, what they want as a team, what individuals want. And what I'm looking at the beginning of this, and I think I go with this a little bit more in the human sexuality one as well. But when you look at these three circles, and I'll see if I can kind of play with this. So this circle, the way it's drawn, and again, this is much more complex topic than it's showing here, but to explain it, this outer circle, think of it, can have anywhere from strong boundaries, which someone has a good, strong sense of self, to very weak boundaries, which could be like a dotted line around them. And so looking at how strong those boundaries are is how strong they are in individuation, is that sense of self, knowing what you want, and how well you're able to push that. If you don't have a strong sense of self, you're likely not going to know what you want. And so there are some gender patterns with this too. And so the outside circle is that, I'll call it the coupley lens here. And so within that coupley lens dynamic is historically, when we look at kind of bioevolutionary dynamics, men tend to be much better individuated overall, which means they tend to be able to focus more on the self. Sometimes that's the complaint. They tend to know more of what they want when they're going through, and it's less dependent on someone else. Women tend to be more relational oriented, which commonly also means that they're dependent and or externally validated a little bit more, but they also tend to look at what is for the best of the team. And as a result of that, some of them tend to sacrifice themselves for the team or for the other person because they haven't set a strong sense of self. And so there's lots of different dynamics that we can draw these to say is, I call it cat and mouse. So if we get rid of one of the inner, let's say if we get rid of this one and this one, it's all pushing one way only. And so in this case, this party is pursuing this party to try to get what they want and communicate, and this party is the avoider. So they're running away. So one person is pursuing, the other person is avoiding. And this is one of those common patterns you'll see in relationships. And I call it cat and mouse. And our focus here is to be able to strengthen all of these systems and understanding where they are at that time. So by strengthening the inner circle here, or the boundaries around their individuation, the boundaries to make sure that they're working as a team and thinking like a team, and how that's balancing with themselves, being able to strengthen the push ability and the pull ability to step back, then we get a well-balanced system. Even from a physics perspective, it runs much smoother rather than spinning in some cases. So I really want you to know that concept of differentiation. It stems from family therapy dynamics because it's a common dynamic you'll see in couples therapy and family therapy as we move forward. So that's my little summary of kind of understanding differentiation and what you need that relationship to look like for it to run healthily. Partly related to this also is the continuum of self. And so basically what I'm having couples look at is, where do you fit within this attachment model, since we talked about attachment last time, and what do you need to do to tell your partner to allow a positive interaction? And so you can have your couples and or your individuals gauge themselves on how level of either codependent they are or emotional manipulator if they're really self-oriented. But it could also be not even manipulation. It could be either more narcissistic or just self-focused. But that self-orientation, sometimes you can move to that +5, which is that focus of self. The balance point is in the neutral, which is right in the middle, where we're looking at kind of how to be able to balance that self with the others again. So this is very similar to my differentiation concept, but it's just a different graph to look at. The more self-oriented, there's also research supporting that there's increased in mental health. The issue is if you go too high up, then you're now just, self-focused, egocentric in that system. So if you have to work in a team or with a partner, even though your increased mental health might work, it might not be very productive in a relationship dynamic. So if you're really other-oriented, you might be much better able to work in a team-oriented dynamic, especially if you have very strong personalities. But commonly, that leads to some decreased mental health if you're not able to hold on to yourself within that system. So that's where we have some of those dynamics. And the term codependent would be when you're externally valid and very other-oriented in that system, that you need them to be able to be in a relationship. So another little graph to help you kind of track and understand what's going on with couples. Another key concept, and this is one of my favorite ones, the relationship crucible. I use this regularly because this is a new lens that I want people to be able to understand and relate, because it's about, and this is from David Snarch, and he did the relationship crucible and the sexual crucible. So this is very related to, even though it doesn't look like from here, it's kind of founded in some sex therapy components. And this is about regulating growth and stability for individuals, marriages, families, and even groups. And so I'll go on this one. So this was also a little bit more complicated than it looks. So think of this graph, this little circle, as a slinky. So this is actually an ascending spiral that's kind of running down and up. And so I'm going to start in the inside because this is where most people tend to want to stay and be. So think of it like this. Most people tend to want comfort and safety. And so one of the consequences of being in comfort and safety for too long is we follow this little graph down here to boredom. And what happens after lots of comfort and safety and no growth, or not enough growth, that boredom it starts to spiral down. And that boredom leads to detachment. With detachment, what happens is if you're not willing to take a risk, it continues to spiral down. And I'm going to go on the outer circle still, because now people will tend to avoid. Once they've detached, they start to avoid. And in that avoidance, we move to the inner circle, which leads to unresolved issues. And those unresolved issues spirals down and continues to spiral down until we get termination. Now, what does termination mean? Well, in a couple, it's them breaking up with you. If you're in a job, it's you getting fired, because it runs the same system. If it's in the self, it could be you're either terminating your own activity. So sometimes it could be related to the activities you're doing. You're bored with it, you detach from it, and sooner or later you just don't do it anymore. But in severe cases, it is death. It's termination of self. Because you've got so much avoidance, detachment, and unresolved issues, it becomes overwhelming and you don't see any options, and ta-da, and it ends there. So the only way out of this inner circle to get to this top one, which is growth, is right here, taking a risk. Now what happens is when people take risks, it leads to anxiety. And the funny part is lots of people don't like anxiety. And so what do? Reduce it. As soon as we get a little bit of anxiety, we have to reduce it. We get to that inner circle of that comfort and safety component, and we never actually get to our growth component because we weren't willing to tolerate enough uncomfortableness for the growth. So instead of reducing it, and this in the beginning stages, because there is a time when we need to do this, but I'll talk a little bit about that after we've got a bit of growth. So in order to kind of get that growth, we have to now actually continue to increase that anxiety by taking that risk. and then learning this key core of confrontation and self-soothing. And this is basically facing your issues head on and learning the art of self-soothing. The best metaphor that I use for this is like weightlifting. You go to the gym, you lift the weight might be heavy, you're going to get uncomfortable, might cause a little bit of anxiety. The heavier weight you can lift, the more you can hold on to it, the more you can breathe through it with not having too much, because we don't want to, burst something, the more growth you get. So that self-soothing component is breathing and repeating it repetitively over and over to face that weight, to gain strength, to grow into that system. Now, when you get growth, it's great, but there's a price for that, as we've seen. And so again, the ascending spiral in this case now moves into when we start to get a bit of growth, we start getting a higher level of commitment and even trust in our ability to manage and handle what's going on. And so we will spiral up the more we can keep growing. And so we'll spiral up for a little bit. And then what can happen is we can also get determination if we keep growing. Now, in a relationship, this is you terminating the relationship rather than inside being the one that kind of gets broken up with. In a job, you might quit because you've outgrown the job or it's no longer fulfilling what you're needing and wanting. In a personal dynamic, commonly I'll see this, you're terminating the activity. So for instance, in hobbies, you've outgrown it, so now you move to something else or you add to it. Now, after you've grown for a little bit, just like back to our workout metaphor, we grow a little bit, we've done our workout, what do we need to do? Well, we need to kind of cool that down. We need to take a break. So we're going to go back into comfort and safety, even between sets. That's okay. So we're going to, rest for 5 minutes, get that comfort and safety for a little bit, and then we're going to go right back out and take a risk with that weight again and face it. So you can do this rapidly in a system. This applies also to relationships. People want to get growth, but they don't want to deal with uncomfortableness. They don't want to have to self-soothe or learn that system. And so when I show people this process, it really resonates with them because we will go in and out of this circle for the rest of our life, no matter what we're doing in our job, our relationships, even our personal selves. And so it's just realizing that these are just two halves of a whole. Comfort and safety is fine because it can hold you in that pattern. I just don't want it to start spiraling down. Comfort and safety is required prior to growth and in between the growth stages. But I want you generally to keep spiraling up, take a break, spiral up some more, take a break, and keep moving forward. So that's the other important concept that I want you to be able to bring to your couple therapy sessions to help couples navigate and manage that. And realize there's going to be uncomfortableness and it makes sense. And why, if they're bored, what might be the issue. So when we start to now move into the relationship navigation components, I want you to be able to talk a little bit about and understand what variables might be present in their system. And so some of the first questions, and you might not know this when they come in, because you now have to start navigating more than one type of relationship. As a sex therapist, a lot of times people may not bring it up, but if they know that you're working and comfortable working in that area, they may bring up the topic that they are non-monogamous, they could be monogamous, they could be in a poly relationship, which is polyamorous, which is multi-love, which they could be involved in 2 or 3 individuals, all either living together or even not living together. They could be involved in swing relationships. So this is where you have individuals who are joining with other couples purely, and they could be for friendship, but primarily it's for sexual experiences in terms of novelty. And there are swing clubs kind of around where they can go. You can kind of hook up with another couple in a safe environment with boundaries. Are they in an open relationship? And an open relationship is where they might be together. There is no particular single individual outside, but they could, if they find someone that they may fall in love with or want to have a relationship with, that person can be included, but it's not fully open. And there's a good book to kind of look at some of these dynamics and the relationship navigation as Ethical Slut. And so Dossie is the author who wrote about that, and she's kind of lived this lifestyle and really wrote a good book on understanding the rules and the ethical guidelines to follow to be able to do this in a healthy way. And so you can have many different types of navigations or relationship styles that if you don't ask or if they don't tell, will complicate your couple therapy sessions, because there's a whole bunch of other people potentially involved, which could be impacting what's going on. With some of my swing couples, it's breach of trust. They originally say they were going to do something and stay within an area, and someone stepped over that line, and now we have breach. And so, they want the excitement of that, but, they're not necessarily wanting the risk that can come with that. And so it's kind of like your extreme sports dynamics here. You need to be able to be really good at navigating relationship dynamics when you have more complex relationship styles. Another common one is, do they have opposite sex friends, and is that okay? So, as a psychologist lens, I encourage people to be able to have opposite sex friends. If they have those, some people say, well, I'm insecure and therefore they're not allowed to have any opposite sex friends. And my question is more I need to know about those opposite sex friends. What's the intent? Is it a friendship relationship? Is it a business relationship? Are there interests, or are they we have like work husbands or work wives that they have? So there may nothing be sexual, or even they're not looking for a relationship, but they have a really commonality. They have a common foundation of beliefs, systems, work kind of history. And so one of the ways to check if this is okay is, normally I'm just going to say, is if they have opposite sex friends, those individuals should be quite comfortable coming over and meeting the partner and being integrated into that relationship dynamic. If they're not willing to meet your partner, my red flags are going to start showing. So, and again, but is that okay? Ultimately, that's their decision. My job will be to help explore, understand, inform, teach about things they need to consider when they're looking at that. To me, there are no black and whites in this system. In terms of yeses or nos, and it's always okay or it's never okay, because some individuals have been taught certain things, and again, our job is to educate them well from healthy psychological principles. When I talked about the differentiation model in terms of with those, me, you, and us, the other question I want to know is, do they have self-time, family time, and friend time with their peers? So this is kind of looking at taking care of self. Do they have self-time? Because some individuals sacrifice, and so they say, I never have time for myself. Are they playing with couple time? So there's also the couple time, because sometimes the couple in the beginning of the relationship only has time for the couple, and so they want to be together all the time. And that's not uncommon in beginning infatuated or even relationships as you get to know the person. But as we get longer and later on in those relationships, we want to be able to have some self-time. We want to balance that with some family time. We want to balance that with couple time and date night. And then we want to do some friend time with their peers, so that we're now going out and being able to connect with friends, and or it could even be family in those systems. But that's kind of watering each one of those key areas well enough so that people are not stagnating. Some people have a little bit more need to be, self-time, your introverts, and some individuals might need to be a little bit more time with friend time and or with people. And those could be your extroverts in those systems. And how do they balance that and negotiate that within the relationship? We talked about differentiation. So again, are they differentiated? What are their weaknesses? What are the imbalances? And you can help identify and help them explore those weaknesses and imbalances when you're working with them. So a few things to consider when we're looking at that. So when we're looking at, again, working with couples and some of this core foundation stuff, the next thing to talk about is rules, roles, and responsibilities. And so part of that is when I'm sitting up with a couple, I want to know what are the agreements? What are the rules that they have agreed upon? Sometimes couples will come in and they don't have any. They're just running off the hip with the expectation that the other party knows what they want and that this is what all people do, or this is what their family did. So you might have to sit down with them and openly talk about what are the rules? Are there any no-nos? So in the sex therapy lens, that's kind of like setting your informed consent, and we're setting up the safe word stuff. So, is this a red light area that's totally off limit? in terms of what they're allowed to do within the relationship. Is this a yellow, which is, uncomfortable? But, if discussed, there could be some options for that versus your greens, which are, we're okay, totally okay with what those rules are. And those rules could mean house chores, responsibilities could be unwritten, like, who does the cooking or cleaning? Do they do that together? Does someone say, I'm doing the inside of the house stuff, you do the outside of the house stuff? The traditional ones would be, from that model, because it's easier to kind of frame, is, historically, men may be the ones going to work, the women may be taking care of the children at home and or nurturing the household system and navigating the family systems. That doesn't always happen. Those can be reversed. But it's just, what are the rules that they have agreed upon, and do they want those agreed upon, or do we need to change some of those because they're not happy? And so when I talk about a traditional system, that traditional system is kind of interesting, because that's that top down. And I have a few pictures later which will explain these a little bit more, but your traditional patriarchal system, which would be, one person in charge, so it's typically that male, and he dictates kind of everything down, versus that egalitarian system, which is kind of that equitable balance. So it's kind of more shared responsibility. And I think the other thing to be aware is, are these responsibilities equitable? And your job as a therapist is to say, does this look fair when we're kind of doing the checks and balances at the end? Does it look like it's reasonably fair? And that would be also partly dependent on what they value. One person might be quite happy doing all of the cooking and or cleaning, and that's what they like to do. That's what they want to do. And someone may say, I want to take over some of those. Like, no, that's my role. That's what I want to do. I want to be a mother or father in that system, and that's that role identity. So it's kind of, are they contributing an equitable amount or the same amount in different areas so that it looks reasonable and fair and is balanced with them? Some people like to overtake on responsibilities. And so it looks like someone's doing nothing. Some of the classic ones, I think I would say, is, one person's doing the cooking, the cleaning, and the other one's playing video games and sitting and watching and or consuming alcohol, and they're not doing the housework. They might not even going to work, or if they might go to work, are they bringing the funds to the home, and is it equitably shared, or are they just bringing it home so they can do whatever they want? They're just paying your basics. So it's just really exploring those couple dynamics to look at, how do those rules, roles, and responsibilities look from a third party, and do we need to do some tweaking from there? And I guess while we're talking, if you guys have any questions, feel free to put those into the chats so they can bring those to me so that I can kind of explore some of those as we're playing with this going forward. So another topic commonly brought up is parenting. So I think anyone who's going to be working with couples and or who want to be parents, I would strongly encourage to be able to take a parenting course, because these resources teach a whole bunch of things that I don't think you can learn otherwise. And so there's some really good resources to help understand the psychoeducational aspects needed to navigate parenting, because those rules are partly related to the rules, roles, responsibilities, differentiation. All these skill sets now get applied commonly in parenting that couples by themselves may not need to fully develop. And so some of the good courses, Triple P, there's active parenting. I know some of the intro developmental courses. There's just understanding developmental milestones in children and adults. Because if you're working with teens and or young adults, or even younger kids, there's going to be a different level of developmental milestones that I want you to be able to be aware of, because commonly when couples may coming in and they're talking about their children, be it young children to even adults, if you don't understand those developmental milestones and what to kind of expect, what are those issues and what is relatively common, you don't have a good foundation to understand and validate what they might be feeling and or give them direction, because this is very off what would be expected. So commonly I'll see couples complain about something that's going on with their children that is technically quite normal. But because they don't have that understanding of parenting or developmental milestones, they're expecting their child, I have so many cases I could, that their 3-year-old should be listening to them on like an obedient child, and why are they not doing that? And so then I need to go looking at and understand those other characteristics of the child. Are there any developmental issues? What would be expected from a typical 2 or 3-year-old? Is this reasonable? And then, as they kind of go through every few years, you get new developmental milestones, which creates new understandings. And children, a good example is children don't develop abstract reasoning very well until they hit around 11 to 12. And so even though they might talk like they have an understanding of abstract reasoning because they're saying the words, their brain usually is not developed well enough to fully develop and understand that internally. And then basically be able to understand from a parenting lens is how the authority in blended families may occur, because you have to navigate who has authority over the children when you have blended families and what are their agreements. And so as I get later on in terms of the couple related to family systems, because I want you to know this stuff, it gets much more complicated. So just a few things to kind of play with. So some of the old books that I remember for parenting, I think one of my favorite was by Dinkmeyer and McKay, which was Be Active Parenting. And so that was the authors. And so they gave some good workbook information. You can buy some good workbooks, and that's the ones I like, because they also have experiential activities for the parents at the end of each chapter so they can practice, or in charts. So that was one of my ones. Triple P is online in Alberta for free through, I think, Children's Services. So you just add in Triple P Parenting online. You can take the introductory course for young children. And I think there's also one for teens. And I think there might even be a third one, but that's something, again, as a resource for you to be aware of for all Albertans. So we'll continue on with the parenting. So one of the key things that I want people to know, and it's not just about parenting, because, as Anna was mentioning earlier, we have what's called an extinction burst. And so if you're going to do any kind of parenting and looking at any kind of change of behavior, I want you to know what an extinction burst is. And I kind of like, it'd be nice to have a whiteboard. So I'm going to go with your traditional extinction burst in a system, and I'll try to talk it through to help to do this. So this is one example of an extinction burst when we're looking at a system. So if I'm going to looking at, and I'm going to start with bad behavior. So this could be bad behavior in a child. I'm going to talk about that as an easier example, but it applies to adults as well. So I'll pick my typical situation where it's, kid wants candy before supper. And so usually what's going to happen is parents will go, no. Typically then what's going to happen is it's almost like this group here, which is a spike. But this is post-burst, but I'm going to talk a little bit about pre-burst. So if there is no bad behavior, and then we have something that, someone wants something, they're not getting their way, we have an escalation in behavior, and so you have to make a choice. And that choice would be yes or no. If you don't give in the beginning, and they learn that's your standard, then they will usually de-escalate pretty quickly. However, if you have given in, or have given in at some point during this, I'll say with this child's, getting candy before supper and they're having a temper tantrum, what will happen is you've now trained them to engage in bad behavior to get what they want. And so what you'll commonly see when people are engaging in a lot of bad behavior over time is because it worked for them. They've gotten what they wanted from it. People have given them, money, candy, whatever they want. They have shied away. They've been able to do what they want, and so in order to kind of get rid of this extinction burst, you have to go through you have to go through the extinction burst or get rid of the bad behavior. So typically what happens is when you're doing that, and I'll try to summarize this quickly because this is a whole nother concept, but I want you to be aware of it because it is crucial. In order to get rid of an extinction burst, you have to be consistent. You have to hold on to what that boundary is. If you want it to stay nice and low and give them what they want, just say yes all the time. But if you want to change that bad behavior, be prepared for bursts of bad behavior, and it's going to escalate. And so the escalation typically looks like when they don't get what they want, and you said no, and you've held to no, then this is where we have our intervention. So what happens is typically we're going to get a spike in the bad behavior because it worked in the past. They're going to try to do it again. And so sometimes what happens is through this process, people may give in around here, they give in around here. And so when they say they give in around here, they've now set a new precedent, because the favorite one I have is if they're in the grocery store and the kid now has a tantrum because they wanted candy, and so they're going to get humiliated and embarrassed. So the parents go, here, have the candy, because they've now escalated up here. You now set a new baseline. Instead of a bad behavior frequency of 20, we're now at 30 times intensity and or frequency. And so when they go to the grocery store now, they want to go with you because they know actually what worked. And it doesn't have to be conscious. This can be an unconscious process that they've just learned. You want to reward good behavior if you're going to do that. So if you hold tight, if you kind of say no in that system, you might have to leave that grocery store, or just keep continuing saying no, putting the time out, allowing that system to not give in for that bad behavior. Then they're going to spike even more. And they're going to go up until they hit their ultimate, it's like a tolerance level. And that burst goes up until they burn themselves out. When they burn themselves out, please don't give in at this point or just before, because that's what I think a lot of parents and a lot of people do. It's crazy, they're getting wild, I can't handle it. It's just easier to give them the candy and stop that bad behavior. Yeah, and now it's going to be much, much worse, because this extension burst here is based on this pattern of behavior. If you reward it here, this becomes a new baseline. Now we're way off the screen in terms of now what the burst is actually going to look like. And so when you can hold to, it's like almost breaking a horse is kind of the similar pattern, as you need to sit on that horse and ride it until it realizes that it can't buck you off, and then it ultimately gives in to you who's in charge. When that happens, they'll drop. They get tired. It drops down even below that level for a period of time. And so then that first spike here is when they are trying to test it again. Because maybe it was just one time that I didn't get my way, but that first spike is going to show itself, and you have to really hold tight on that one. Once you go no, and no means no, you'll see it drop right back down. This becomes your new baseline for that behavior, with occasional spikes, because they're testing in that system. It's natural to test. It's healthy for test. If my kids are not testing those boundaries, I'm getting concerned, because then they're not able to kind of push on their environment to be able to adapt it, and they're now passive and almost helpless, get into the learned helplessness. So this is a healthy pattern. It's not a fun one necessarily to go to, but just please don't get stuck into rewarding or having your parents reward a really bad extinction burst, because it's just too uncomfortable. And this is why in parenting, I think one of the good skills you learn is you really learn how to know what you want, and learn how to hold on to those boundaries, because a 2-year-old is much easier to handle those boundaries than, an adult, because the 2-year-old doesn't have the same level of sophistication to manipulate or navigate you, or intensity commonly. So take a look more on extinction bursts, because it's not only for parenting behavior, it's for any bad behavior. So just something to think about. Any questions about that as I go on? So now I'm going to be moving into structural systems in families. So again, when you're looking at family therapy, that's one component. But if you're going to be working with couples, I really encourage you to need to know some family system stuff, because it's all interconnected. And you need to know partnership styles and how the family's running to be able to help navigate your couple sometimes. So it's not always, depending on what case they're bringing into you, that's the stuff that you need to be able to write down and bring, so that you know and are focused on those goals. So we can have what's called, I call it a traditional family structure. And so in this traditional family structure, and this is kind of, I wouldn't say it's even the full, this is more like the healthy traditional family structure. Even though we can mix and match, this looks like more like a a heterosexual cis dynamic. I guess they have the pet there, so. But here we would have a cisgendered kind of couple with kids, where they have the two kids who each have a partner, and then they have two kids here who may have a partner with kids. But in terms of this top-down dynamic from an authority lens, even though these are all adults, you could run the same thing with kids in a smaller area. And I'll show you some of those as we go forward. But generally, these two are generally balanced, right? They're kind of egalitarian in that system. And so, from the model here is elders tend to have, at least in concept, are higher on the structure that they, should be respected and should be acknowledged. And so they have more wisdom. And so there's that lens that kind of, we can come from there. Now, I couldn't find a really traditional family structure from another model, so I'm taking it from an organizational chart. And the other traditional family structure is where you have the top down. So this would be like a good traditional, call it your farm family in a system maybe. Here we have Catherine. Catherine here would be your matriarch. And so in this case, the matriarch is in charge and directs the husband, in this case might be Milton. And so they run top down and they have 1, 2, 3, 4, 5 kids. And so Milton runs the kids and is responsible for the kids in this case. Catherine's in charge of the ultimately final decisions in the system, right? And then you might have others down in that system because they might have people underneath them, but it runs a very similar model. The other traditional model, the family structure, would just reverse these, is the patriarchal system, where if Milton was on top, he gets to dictate and say what's going on regarding the family ultimately, and the person underneath them is now managing the kids and the family. Interestingly, there's this struggle, this fight back and forth. What I'll say is, when we're looking at family structures, is although men historically were viewed as being the patriarch and or in charge, we're looking at that historically women tend to run the family. And so when we're going in there, it's an interesting struggle, and each family system may have these subtleties in it, one person might be the figurehead, but really mom's running the family and gets to dictate what's going on, even though she doesn't act like it. She could put him in there, or the other way is he's very passive and she's running, it could be very dictatorial, might makes right. Dad is in charge, dad dictates everything, dad's telling mom what to do, or the partner. And so it's very kind of that run. So it's just understanding what these different family structures are like, and how they are running them, and how are they running those systems. They're not necessarily problematic. I had a client, I kind of raised my eyebrow. I have a client who said really she wanted to have children and kind of be told what to do in the host household and be directed. She wanted a strong leader in the household. She wanted to be responsible for the cooking, cleaning, and the kids. And she was really happy in that role and wanting to do that. And she was Caucasian. And so she would be then looking for someone who is willing to take that, hopefully in a healthy way, and it can be done healthy. But it also can be abused very easily. So it's just digging into those to know what that looks like. Because we also have blended families. And so with blended families, this is where we start getting more complicated, because this isn't your original system. This is where we now have, a husband and wife can have a former husband and a former wife, and then they could now have sharing of child rearing. So this couple, may have one child. This couple has a girl. This couple has a girl. And now, because this couple is having all 3 children, let's say, together on a weekend, how are they running the parenting structure roles? And so you might have to help them navigate who's in charge, how is this running? Are they running that, in this case, only the husband has authority over this girl, only the wife has authority over this girl, and both have fully over the boy child? Or are they running that we've agreed upon that, and this can be, and there's so many different modifications of this, that these two children, because this former wife agreed that the new wife is okay to be fully responsible for this girl when they're in the presence. So they're running the same as these two children, but this husband says, no, I'm not letting that husband have any authority and or tell my child what to do. So therefore, these three children, these two may be treated the same, but this one's going to be treated differently just because the wife is the only one that has the authority to dictate what's going on and or consequence and or set the rules. But you could have situations where they're all treated the same and or all treated differently given what the rules and the authorities are within the blended family. And you need to know that. And here we have, again, another structure to be aware of where, one person might be responsible for two kids who go down that system and who has authority. So again, there's a few different models for you to be aware of. Just want you to kind of think about that, be aware of it, and understand that who has authority and that you have to explore who has authority and is that reasonable? And that there are options for that. It's not that everyone needs to have full authority over the children. All parents get to have their consent and they have to navigate and agree on that. And you have to work within that role or different roles. Okay, welcome back. Had a good break, and so now we're going to move into the last half of our session for number 2 for couple stuff. So a few more things that I want you to be able to be aware of before we kind of now move into more case conceptualization stuff, and I have a few little goodies at the end for you. And so we're going to have lots of time to be able to go over some case issues. The hard part in doing videos for this is because there's so many possible videos that we could look at, and it's not really a nice, easy one that I could have conceptualized. But I think the next step from here would be we'd be taking some videos, we'd be analyzing it similar to what the Gottman model would look like, and then that would be kind of going on. But I encourage you to take the Gottman level training because they do a lot of video work through and case conceptualization. So a few things to understand when you're dealing with couples in terms of cultural rules, standards, or even expectations. So watch for double standards regarding gender or culture. I think I have a case where, well, even from a lens, I'll pick a case that I'm dealing with particularly from a cultural lens. So we have a professional woman who comes from a culture where women are not viewed and there's a very top-down male hierarchy system. And so even though this woman is a professional, and I believe her profession is technically a higher education and or higher status than the husband, they're not viewed as that. There's still that need to follow. And then because of the social pressure in the culture she is looked at as the one that is causing the problems, her behavior needs to be much, much higher in terms of standards than his. And they tend to also support the patriarch in this case. So even though she might be in the right and being able to do that, the family systems, the husband, all of that are against her and basically saying that she's the problem in that system. Interestingly, the kids are aware of what's going on because they've become more westernized and understanding a little bit more on that. That's less kind of culturally impacted by other cultures and more from a North American culture. So just be aware that there can be some double standards in terms of gender. I've had cases where I'm working with individuals who are trans and, they can't go back to their culture because of fear of execution, of death, of stoning, of cultural discrimination, and even within their family system, they're, in the relationships being, anyone in the LGBT community, there's lots of cultural standards or issues that will cause problems. And so what you might, by having them be open and honest, which is what we tend to want to talk about, might be actually detrimental to them and, almost even terminal in some cases. So just really, that's where your cross-cultural dynamics become important to understand, is what are the norms of the cultures that you're working with, and the more you get experience in working with different cultures or even getting training, it'll help you understand those systems. Also be aware of eye contact or touch. In terms of Aboriginal context, eye contact is commonly viewed as not appropriate to elders. It's viewed as dismissive and or it's inappropriate. And so I've dealt with cases where the child is following more of those cultural standards and not willing to make eye contact with their therapist, but the therapist is getting angry because they're not willing to make eye contact with them, and then we run down this spiral because they weren't aware of it being a cultural issue. As spacing is another issue. Cultures in terms of Europe tend to sit and or be more comfortable with being right close commonly, and even talking right up front. And so when we talked about the feel-or stuff and distancing, balancing, you might have some of those cultural issues in there. A European kiss might be not even considered anything, where here someone, might be traumatized by that if someone is expressing that to them and they're not prepared for it and they come from a much more conservative culture and or even religion. So be aware of religion impacts as well. Something in one context or culture may totally not be acceptable in another. And that's where I want you to be inquisitive, inquiring, and ask really good questions through that process. In some cultures, saying their opinion is not appropriate. Or even talking to men, talking about topics like sex. So it's really, I'm not going to teach a cross-cultural course, but I want you to be aware that these cultures and or religious kind of lenses have certain standards of what they expect, to be within that system, and going against that can be very challenging, even whether it's healthy or not. So again, just be aware of those. There are certain topics, again, sex is a common one, not allowed to talk to men, or for some women are not in cultures. And so some individuals, even in cultures, will just their job and their perspective is just to be obedient and follow and not talk, period, even if they're not introverted. And so just when you're noticing those, ask questions, be curious. Sometimes when we're dealing with families and cultures, then we have extended family. And so dealing with extended families can be very problematic if those family systems are very different, or they're over-influential on that core family couple that you're working with in a couple lens. So try to get a good understanding of that, that family system when you're looking at it. And so you can even do your genogram if you want to do a quick genogram, just to know who are the power players in the family system, what are the general rules, who are the problematic ones in the family system that, we might need to avoid, or work as a team on being able to, if they want to have them be involved, how can we do that? And then the other one was really interesting is when we have the roles within individuals, and this can even be, I'll say this with your North American culture, the hats that someone may play and what they prefer. And I'll speak because sex to me is probably the easiest one, well, not for work. But the hat that they put on work, they could be a CEO, they could be a manager, they could be very assertive at work. They could come home and then they take off that hat and now they choose and or just given the home dynamics, they are the passive one. They're the ones that are being told what to do, and they could be totally okay with that. Some cases, what they wear at work gets, brought home and they're in charge no matter where they go, or they're being told what to do where they go. And when, commonly I'll say is some of those patterns in home might be actually inverse opposite of what is done in the bedroom. And commonly I'll see this when we're talking about, I'll say my assertive women who might run the home very assertively and quite dominantly, in some cases in the bedroom, want the exact inverse opposite. And so they want someone strong enough to be able to be running that system in the bedroom. And so make no assumptions about how these roles are, because each location may wear a different hat and may require different roles and or behaviors for them to follow, which they have maybe either accepted or that's how they have chosen to run. So if you can think of any more examples within that system, I would encourage you to bring that forward. Now, we talked last time as one of the key components is breach repair. And sometimes as we were talking, you can't get close when the hurts are kind of interfering with what's going on. And so one of the key models, excuse me, that I like to use with my clients is by Gary Chapman, is the 5 languages of apology. And so Gary Chapman wrote a book. I was actually looking at creating a model and kind of was frustrated with the models that were out there because they weren't nicely applicable to circumstances that were easy to follow. And so it just happened to be, I was looking at a bookshelf at West End of the Mall. I remember the day because I just like, wow, what's this? This is kind of repair and apology, and it's kind of, it looks like a nice, simple model. And so when I read it, it has a lot of the good core foundations that I want people to know about. And so I kind of incorporated it. Now Gary Chapman incorporates some spiritual stuff to that, but I just let the clients know that, that's not a requirement of this process. But what I want to do is just be able to understand the model. And I've done a few modifications that I want you to think about in terms of how he kind of puts it versus how I have kind of tweaked it, I'll call it. So in terms of Gary Chapman, so when there's been a breach, so how I look at it is the breach repair will need to go through 5 stages. And so I'm going to follow his model, and then I'll tell you my little add-ons. So the first one, and again, there's a book on it, there's some handouts. I'm not sure if we have that on the add-ons, but you can easily find those online under, I think, Gary Chapman in terms of the 5 languages of apology. He has a nice little summary sheet. That's just about 3 or 4 pages, which is really nice. And so the first step is the expressing regret. So when there's been a breach, and now when I'm working with couples, I need to know whose issue are we working on. And so I will structure this very much. If there's been a breach and one person is hurt, we're going to make a dedicated intent to work on that hurt by the breacher or even the perceived breacher. And so this is where sometimes just because there's a breach doesn't mean it's actual breach. It could be a perceived breach. And the perceived breach is, I could have said something honest, but your feelings got hurt. And so you're angry at me because I hurt your feelings when really your feelings got hurt by what I said, but I wasn't doing anything wrong. And so that's where the lens is between an actual breach and or a hurt feelings or a perceived breach. The repair process still can work in a very similar way. It's just slightly modified. So again, expressing regret is I'm sorry. Being willing to say those words. I'm sorry that your feelings got hurt. I'm sorry that I hurt your feelings. I'm sorry I went out, and either got drunk, or there could be so many breaches that we're crying. But, when we're looking at these breaches, just also be aware that was it actual breach because did they make an agreement, or was it just, you did something that I didn't like and now you breached, but we never actually agreed upon it. So this is, again, understanding those rules, roles, responsibilities. And if there hasn't been no agreement set, then, there's technically has not been a breach unless it's, I call it common knowledge breach stuff. So once they're willing to say, I'm sorry, that's the quick summary of that. The second step would be accepting responsibility. And that's the acknowledgement of the wrongdoing or the responsibility for me being that part in that play. So and then we want a timeline. So what reasonable timeline and how many frequencies so that we can actually package it. And then we will review it. So if it's like 3 months of them doing this, then we check after 3 months where that restitution, the balancing is. And normally I'm going to scale that like on a 0 to 10, where is she in terms of making him restitution amends for him. And he should be able to give me a number to some degree. Like, we want to see change. It could be a 3 in the beginning, or if she's done some stuff, we want, is it about a 6 or an 8 by the end? And it still might be good. And until we get to that level of step 5, or, 4 and 5 are as you get closer, the genuine repenting, as he calls it, is the willingness or agreement not to do it again. So this is your safety net. What is set in place to make sure this doesn't happen again, so that we have a safety system and a future-oriented going forward, and then requesting forgiveness. Will you forgive me? Can you forgive me? And that those words become really important. The key words, I'm sorry, is one, and do you forgive me? If you say, can you forgive me? I can, but I'm not. Will you forgive me? Yes, but not now, not for a long time. So be really picky with the words, because people can get really sneaky with that. And so it's like, are we done? If there's any hesitation, it's not balanced yet. There's still more work that needs to be done, because it's like, can you forgive you? Like, oh, like I want to forgive you. No, we're not done. More restitution likely needs to be paid to rebalance that. And that person who's giving restitution has to be okay with it because it looks fair and reasonable given the breach. Does that make sense? Does that help you enough with your case to kind of structure it more, to keep it moving? Okay. So yeah, so this is the 5 languages of apology, right? My other little modifier, just to help people, if it's not getting good closure, then what I would say is that's where my payment plus interest plus bonus. The interest, here's my example of the breach that Emily brought up. So let's say that, he found out about the affair 2 years later. We have 2 years of her keeping a lie and not being honest about it. And so there is a price emotionally attached to that he might not be aware of, and she might not want to pay, or might not even be aware of. And so I want to give that credit because that's deceitful for that 2-year period of time. And so there's going to be, that's your interest payment. You don't pay up front when you did it. You're going to be paying a 2-year interest kind of payment equivalent from that for hiding it because it's not being transparent and, lying by omission from the agreements of the relationship. And then the whole fact I call it of the bonus. The bonus is for addressing the emotional component of having to go through this in the first place, given the other person's breach. And the closest metaphor that I think that I see with that is our government income tax system. Once you're owed, you have your taxes done. Once you're owed, you pay on that time, or you will be paying a penalty payment and interest payments daily from that point on. So they got a really nice tight system, and I respect it. And it also makes sense because they're having to manage all those systems. And so it's a motivator to make sure things are really well balanced and everyone gets cleaned up nice and fast. So when you're looking at the restitution components, you might need to add in points and or something for doing it in the first place, because metaphorically, if I stole $1 million and all I really need to do now is pay it back, I still got all the interest if I put that in the bank or an investment account. That's not included, right? And then the crime of doing it. So these are how we kind of look at it, from a legalistic lens. So yes, have fun with that. So we talked a little earlier about falling in love too. And so there's an interesting little article, questions. So Arthur Aron, there was this experimental generation of interpersonal closeness, the procedure for preliminary findings. And what they did was they looked at 36 questions for individuals. And what they found is the goal was increasing levels of self-disclosure and closeness. And what they found actually more was that it impacted this falling in love feeling with a lot of individuals. And the questions, and I think we have a copy of this, or there's a connection on this, the questions were really straightforward, simple, not something you'd be expecting individuals to actually kind of think about falling in love and bonding. And so some of the questions here, if a crystal ball could tell you the truth about yourself, your life, the future, anything else, what would you want to know? Or if you were to die this evening with no opportunity to communicate with anyone, what would you most regret not having told someone? Why haven't you told them yet? I think there's stuff like, if you had to go for a supper with someone, who would it be? In all through time. And they were quite generic questions, but they forced people to really think about that. And when they were doing that sharing component, and I can see how it's kind of related because this requires some level of intimacy and willingness. In this picture is a good example, is commonly when people are talking about this stuff, because now it's not just pat answers, they're making eye contact, which is causing bonding to occur. In this case, there's some touch, which is causing bonding to occur. It's causing thinking. It sometimes could even bring up feelings. And those feelings will facilitate bonding to occur. And so all those components added in, they found that, these individuals were rekindling some of those old falling in love feelings. So it was an interesting one. So I wanted to add that too, because what we talk about a lot of times when couples come to counseling is, well, we've fallen out of love. We're no longer in love. The love is gone. And so I will use this list of questions or give them some options to play with this, to go on a date night, to be able to run this as one of the possibilities in that. And when I talked about date night, I think I talked a little bit about round 1, but round 2, I'm just going to recap and reinforce. Date nights can include movies, but that is not a date. It can include food, that is not a date. For me, a date, this would look calmly like a date. I want some kind of interactive activity that they can do together. Preferably someone is leading, someone who's following, and that can last. Normally I recommend dates about 2 to 3 hours is really, a good time for that date. It could be as simple as walking and talking. It could be as simple as going for a walk and not talking. But they are doing something together rather than watching a movie or having a meal, because they don't need to technically interact when they're doing that. Now, if they choose, and I playfully put, if they're in the back of the movie theater, like making out, now we have interaction. I can say that, sure, there's your date, if that was what their intent of the date was for. So there's lots of playful things you can do on that date tonight. But encourage someone to take the lead on that and alternate responsibility for that lead. Because people tend to go, I don't know what I want to do. Well, I don't know what I want to do, and nothing happens. And so when no one takes the lead, no one holds the other person accountable to it, and it stalls very fast. I talked a little bit about the love stuff. So we have this nice little add-on graphic that I think Destiny threw in there nicely. And so just to help you identify more of the types of love that helps you kind of communicate to your clients, I'll go through some of these. So we have the philia. So this is where your, the paraphilias, people have heard probably, pedophilia. So this is that affectionate love term. And so when we're looking at terms, that's what it actually means. It just means kind of that love. Storge, I believe that's how it's called, is that familiar love, fond memory, friend kind of dynamic. And I don't know how to pronounce Felucia, I think it is. That's the self-love. And it creates friendships and builds you up. So this is that self-care component. In terms of significant other type of love, pragma, which is the enduring love. You'll see that with your working together with a partner. That can be part of that friendship kind of love, or very good, close, like long friendship, best friend dynamic. Eros is the romantic love, and that's that kind of closest to that passionate system. Ludos is the playful love. That's that humor, flirting kind of dynamic. Then we have Storge, which is the same as the familial love up in the family. Agape is the selfless love, and that's putting your personal needs second. And so you'll see this lots with mothers and or fathers, where, and that can be appropriate sometimes because, it's just nurturing and taking care of someone that you may care for above yourself at that point because you don't necessarily need it. And again, philia is for the other family, which is the affectionate love. So again, another nice little handout to talk about love. When people go, do I love? What kind of love? It just helps put a label to it so people understand what that might look like when there are feelings, and particularly with my guys who tend to have a harder time expressing feelings and or love, I can now have a word to help them identify what kind of love they have for their partner, which is an amusing process. Another key thing to look at is kind of domestic violence dynamics. And so the main model that I played, and I went to Duluth, I actually did my grad school in Minnesota, Duluth, and got trained by the developers by this twice. They gave it to me for free. So it's been upgraded over the years. And so it's just really good understanding when you have abusive dynamics or power and control dynamics. You can take a look on their website and they will have a whole bunch of different kind of power and control wheels. There's typically the power wheel. This is 1/2. And so here, this will give an example of, verbal abuse or, using power to kind of influence someone. And these are all the unhealthy power dynamics. The other side, so this is power and control. The other side would be your equality wheel. And this is the healthy behaviors that you're teaching someone to work with. So again, I think individuals originally had some issues with the power control wheel from the Duluth model. They've upgraded it. I think it's still a really good model to run with because it gives you a good balance between kind of where the problems look at and what we want to do. And they tend to run a lot on psychoeducation and teaching to help create a better understanding and get improvement in these areas. So if you're helping someone understand what kind of abuse might be going on, this is the best wheel to explore in my mind to say what's going on, how does that look, and you can go through the key components in each area that might be occurring. Historically, it was biased against men, and that was originally because in Duluth, that's pretty much all the men's groups that they were running is because the men were the assaulters in the system. And so even though there was domestic violence with women occurring to men, the men didn't talk about it, and even when they opened up, I did my dissertation on domestic violence stuff too. So men weren't using the resources that were available to them because of social stigma and or, yeah, it's a common pattern. It's not being used. So just some nice stuff to be able to utilize to add to that toolbox of yours. You can print off the power and control wheels, and I have them, I have them in my office, and I'll use them regularly when someone's going, that's not abusive. It's like, take a look. Here's what it should look like. Here's what's going on. And so go from there. So we're going to spend now some time looking at case conceptualization, some case stories. If you have case stories you want to bring up, then please feel free to. So I'll go through some of these of things that I have heard in session that I want you to not roll your eyes too much, but just so I can help you conceptualize probably the most common issues that I have seen. So we'll start with my first one. It's not what I feel versus that's not logical or important. So what I'm looking at is commonly when we talked about that case where individuals may be very feely versus thinky, and they can disregard either the other person's feelings or thoughts. But I've had cases where on my third one here is, my feelings are real, therefore you're having an affair because that's my feelings. If I feel like you're having an affair, then for all intents and purposes, you are having an affair, and don't discount my feelings. And I'm going to go, well, those actually aren't feelings. You could feel jealous, you could feel scared, you could feel worried, but those are based on thoughts. So what are the thoughts? Well, I think he's having an affair. Is he? Well, I don't know. So we have to now go back and do our validation or verification of, is this actually happening versus stinking thinking and having them run through their feelings. And so you'll sometimes have the feelings not validated because they're not important or it's not logical, and therefore you should just be able to kind of do what's necessary. So it's navigating both of those nicely in terms of feelings and thoughts. In my breach dynamic, you have this internal struggle. And so this is where I want people to go, where they say, I don't believe you, but I don't believe you're lying. And so this is about trust. And so my question here is, what is their history? So if you don't believe, are you not believing them because you don't trust them, or you're not believing them because of something that's happened in your life that may have impacted you that you're now bringing forth to this relationship, and you actually may trust the individual, but you're triggered because of old stuff. And so I need you to be able to pull those out to know, do you believe that they're telling the truth, and or are you just not believing because it hasn't happened enough to stabilize? So, with your breach, you might say, I believe you're honest in terms of the apology and that you've done all this stuff, but I'm still worried it's going to happen. And that's valid, but it needs to be able to allow us to keep moving forward. Kind of, again, when we're looking at agreements on cost analysis. So I briefly talked about that with Emily's case. It's, sometimes people will go with, what is an affair? What is the cost of an affair on the relationship? What is the price to be paid to rebalance that versus money? And so sometimes I've given a case where, playfully to get a gauge, is there a price for the breach? And that's kind of to help you understand the emotional value. I said, if your partner was to have an affair, and I was to give you, $5 to make up for that? Would that be enough? And they might go, no. How about, $1,000? And they might go, no. And I said, there's no price that can be there. And I go, okay, how about 100,000? And they go, well, now that you mention that, if you give me $100,000, then sure, it's worth it. I think there was an old movie about